camera. Hello, hello. My name is Hedley Quintana. I am a medical doctor from Panama, and right now actually I am doing a PhD in epidemiology in Karolinska Institute. This video actually is dedicated to B from Romania, and one of the topic I would like to speak right now is because I would like to talk about some mental disorders in general. I am a GP. In theory, the GP shouldn't know so much about this topic, but I should know about little of these things that I would like to share, especially with you, B, that you want to be my colleague. Okay, regarding mental disorders, there are, in order to have a mental disorder, you have to have two main characteristics. That is, the first one, that should be a disconnection between what do you feel, what you think with reality, is one thing that you have to have. And the other thing that actually is a very tricky, because actually it's very problematic, but it's the way that I find. You have to have no support from from any environment about these ideas. For instance, I can say that this is my right hand, and and I put here, and I say that it's a little dragon here. So if I say that it's a little dragon here, and you cannot see the dragon, what happened? Sorry, it's a glitch I have here. Okay, I was saying that here actually is a little dragon, and I can able to see in theory, but actually it's not really there, but I am pretending that it's there. And when I say that here is a little dragon, and you cannot see anything, and nobody else can see anything, and nobody can support my idea, actually this actually is, I have a manifestation of a mental disorder. However, if I say all white men should die, and that thing actually is not grounded in reality at all, but they are actually a subgroup of people that actually follow that idea. Then actually, this is actually not considered a mental disorder, because there's a group of people following that. This is the reason actually the social justice warriors that everybody talk about them, although they can speak bonkers and crazy things, they are actually not considered crazy, because there are a lot of people actually thinking in a similar way. Although it's not really grounded in reality. Same happens with religion. However, we have these two main components that you have to have in order to have a mental disorder. So once you have these two things, then you have to have, I would like to talk about some mental disorders that are deadly. And in my very short experience, I don't have a very long experience as a GP, I'm more academic and blah, blah. The two main problems actually that the three main problems that are actually considered deadly as a mental disorder are first, a false mental disorder. I will explain that later. Then you can have depression, and the third one is you can have alimentary disorder. To be honest, I haven't actually, well, maybe as a student, maybe I have seen, and disorder actually represent from the most common to the least common. So the most common thing is a false mental disorder. Then actually you have depression, and finally, very rare, you have actually these alimentary disorders. In regarding to the false mental disorder, what I mean with false, I mean that you can have any kind of disease, and these diseases are deadly diseases, and actually are related to medical problems that actually have a debut with mental symptoms. What I mean with that, for instance, I had a patient. It's a very typical case of that. He was entering into the ER. I was working ER, and he was actually in a wheelchair, and he was saying that he wanted to die, and he was very sad, and I was speaking with him. I was speaking with his sister. There was no reason for being sad. So then actually I started to examine the patient. I should be as a medical doctor, and I found that he had hyperreflexia, and he also have difficulty to follow orders. I ordered a CT scan. I had bleeding in his head, and at the end of the day, he has a leukemia. And the reason actually was sad actually is the leukemia. And if you treat the leukemia, in theory, actually the patient should be better. And although the leukemia, as far as I understand, the type of leukemia that he has is a very bad type. So it was an acute leukemia M2. But anyway, at least we have the diagnosis for this kind of person. There is another one who tried to kill himself, and the reason he wanted to kill himself he was not able to see due to a medical problem in the eye that you operate and that's it. But he didn't know that, and he preferred actually to try to kill him, but he was actually caught on time and spoke with me and so on. So actually, these are the actual false mental disorder that are not really there. They actually has another thing. Usually the psychiatrists in my country, they call it organic disorder. The other one actually that is also deadly is depression. Depression actually have a series of characteristics, have to have some length in time and other things that I will not mention in this video to make it long. But actually you have to be aware of that. And important thing, in order to have this depression, you also have to discard any other reason for depression. Medical reason mainly. One of the things that come to my mind is, for instance, disorders associated with steroid hormones, for instance, Addison disease or Cushing syndrome or Cushing-Goin syndrome and this kind of thing, mixed edema. All of these things actually you can debut a patient with depression, but it's not depression. It's actually these other diseases that you have to treat in order to cure the patient. Well, you have the third one. The third one actually is horrendous disease. Actually, that is the alimentary disorders. The alimentary disorders actually, although you think that these actually are related to excess in consumption of food, actually this is the opposite. This actually, you have a restriction in the consumption of macro and micronutrients, and this kind of thing kill the person. What I mean with that, you can have, usually they are, I don't remember the exact number, they are actually classified in the F chapter of the ICD-10 codes, and also they are also in the ICD-5, the DSM-5 actually, they are also classified there. And this actually, this disorder actually, you can have a pure restriction of calories that actually is called maybe anorexia nervosa, that you actually don't eat at all, and you become thinner and thinner and thinner and thinner and thinner, and you die actually, not for eating. And the other disorder that is, these are things very rare, not common. And the other thing actually, you eat a lot and then actually vomit to get rid of the food. I think the Terri-Schiavo event that happened a couple of years ago was related to it's called, this latest called binge and purge. You eat a lot and then vomit. This Terri-Schiavo event actually was probably due to any hypokalemia caused by problems in the heart. I will give a description of that in the box. So you have, now in conclusion, you have 3 main mental disorders that are deadly. The first actually are the false mental disorder, and medical condition in the environment that actually make that congruent, what they say with the environment. Then you have this second depression that is unexplained, sadness, gloominess, blue look. So you have no explanation for that. And thirdly, you have the alimentary disorder that I expect that they are very rare. I never have seen one of these before. They are just described in the books. But these are the thing actually I would like to share with you. I would like to give a feedback about this video and okay, go on with your project. And one thing I shall recommend, not keep as a GP. You have to be something else. Bye, B.